If you are over 60, stop doing these 4 exercises immediately. You are not 20 anymore, and training like you are is not keeping you young. It is fast-tracking you to a knee replacement. I see this tragedy in my clinic every single week. Patients who are disciplined and trying to stay healthy, yet they are unknowingly grinding their joints to dust because they are choosing the wrong movements. They think the pain is just part of aging. It is not. It is a warning signal that you are damaging your body. Today, I am going to expose the 4 most common exercises that are dangerous for the senior body, and I will give you the 4 medically correct alternatives that build strength without destroying your cartilage. This is about training smart, not just hard. But before we save your joints, please take a second to comment below with your name and where you are watching from. I read every single one. If you are ready to exercise without pain, like this video and subscribe to the channel so you never miss a health update. Now let's get to work. Let's begin with the lower body. For decades, the deep squat has been evangelized as the foundational movement for leg strength. While this is true for a younger athlete, the biomechanics change significantly as we age. When you perform a deep squat, dropping your hips below parallel, the compressive forces on the patellofemoral joint, the kneecap, and the groove it sits in can skyrocket to 7 or 8 times your body weight. For a 60-year-old knee, which likely has some degree of cartilage thinning or reduced production of synovial fluid, this is a recipe for disaster. The menisci, those shock absorbers in your knees, become less vascular and more brittle with age. Subjecting them to extreme angles under load is unnecessary. Furthermore, we must consider the lumbar spine. As we age, hip mobility naturally decreases. To achieve that deep position, the body compensates by tucking the pelvis under, known as a butt wink, which forces the lumbar spine into flexion under load. This is a common mechanism for disc herniation. Additionally, the vascular strain is real. The Valsalva maneuver, often used in heavy squatting, causes sharp spikes in blood pressure, which poses a risk for those managing hypertension. The solution is not to stop squatting, but to modify the range of motion using the chair squat. This is not a regression. It is a tactical adjustment. By placing a sturdy chair against a wall behind you, you create a physical safety stop. You perform the standard squatting motion, hinging at the hips, keeping the chest proud. But you stop the descent the moment you make contact with the chair or hover just above it. This limits knee flexion to roughly 90 degrees. Biomechanically, this is the sweet spot where we maximize quadriceps and gluteal engagement while keeping the shear forces on the knee joint within a manageable range. The chair also acts as a psychological safety net, reducing the fear of falling, which allows you to focus purely on the muscular contraction. You maintain the alignment of the knees over the toes, preventing valgus collapse where the knees cave inward and drive up through the heels. This preserves the functional pattern of standing up, which is critical for independence, without grinding the cartilage away. Moving on from the mechanics of the squat, we must address the cardiovascular system and the misconceptions surrounding high-impact endurance training. There is a prevailing myth that to have a healthy heart, you must pound the pavement. Running is often viewed as the ultimate symbol of vitality. However, we have to look at the physics of running through the lens of a 60-year-old skeletal system. Running is basically a series of controlled collisions. Every time your heel strikes the ground, a shockwave travels up through the calcaneus, into the tibia, through the knee, and into the hip and lower back. This impact force is roughly 3 times your body weight. Over a 5-kilometer run, that is thousands of repetitive microtraumas. While bone density is a concern as we age, there is a fine line between osteogenic loading, which builds bone, and destructive impact. In older adults, the recovery rate of connective tissue, specifically tendons and ligaments, slows down due to reduced collagen synthesis. This makes runners in this age group highly susceptible to Achilles tendinopathy, plantar fasciitis, and stress fractures. Furthermore, The risk-to-reward ratio regarding falls is unacceptable. A stumble during a run due to slightly diminished proprioception can lead to a hip fracture, which is a catastrophic injury associated with high mortality and morbidity rates in seniors. We need to separate cardiovascular conditioning from orthopedic destruction. The superior alternative is the stationary bicycle, or moderate, brisk walking. Cycling provides a closed kinetic chain exercise where the foot is fixed and the body weight is supported by the saddle. This virtually eliminates the ground reaction forces that destroy knees and hips. You can achieve the same heart rate zones, stimulating mitochondrial density and cardiovascular efficiency, without the structural pounding. It is vital, however, to set the resistance appropriately. Too high, and you strain the knee. Too low, and you gain no benefit. The goal is a moderate intensity where you can speak, but would rather not. This is the aerobic zone that strengthens the heart muscle without spiking cortisol. If you prefer being outdoors, walking is excellent, provided it is done with purpose, briskly on flat terrain, to minimize trip hazards. Now let us shift our focus to the upper body. The traditional push-up is a staple of calisthenics, but for the senior demographic, floor push-ups present specific anatomical hazards that are often overlooked. The primary issue here lies in the wrist joint. As we age, the cartilage in the carpal bones can degrade, and forcing the wrist into 90 degrees of extension while bearing a significant percentage of body weight can exacerbate arthritis and compress the median nerve. Furthermore, the shoulder complex is notoriously vulnerable. The rotator cuff muscles, specifically the supraspinatus, often have decades of wear and tear. A standard floor push-up requires a high degree of stabilization. If the core is weak, which is common due to sarcopenia, the lower back sags, changing the angle of the shoulder and increasing the risk of impingement syndrome. We need a way to load the chest and triceps that respects the limitations of the aging shoulder capsule and wrist joint. The biomechanical answer to the risks of the floor push-up is the incline push-up. By elevating the hands onto a stable surface like a countertop, a heavy desk, or the back of a secure sofa, we change the physics of the movement entirely. You are no longer lifting 65 or 70% of your body weight. You're lifting a fraction of that, depending on the angle. This reduction in load allows for perfect form. You must keep the elbows tucked at a 45-degree angle relative to the torso, rather than flaring them out to 90 degrees. Flaring the elbows is the primary cause of shoulder impingement. The inclined position also places the wrist in less extension, reducing joint compression significantly. This variation creates a manageable challenge for the pectorals and triceps while allowing you to maintain a rigid, plank-like core without sagging, thereby protecting the lumbar spine. It transforms a high-risk maneuver into a sustainable strength builder. Finally, we must discuss the abdominal region. There is perhaps no exercise more misunderstood and potentially dangerous for the senior spine than the lying leg raise. The intention is to work the lower abs, but the anatomical reality is quite different. The legs are heavy levers. To lift them off the ground while lying flat, your body primarily recruits the iliopsoas muscles, the powerful hip flexors. In many older adults, the hip flexors are already chronically tight from years of sitting. When these muscles contract powerfully against the weight of the legs, they pull on their attachment points on the lumbar vertebrae. This causes the pelvis to tilt forward and the lower back to arch excessively off the floor. This creates massive shear force on the lumbar discs, particularly at the L4 to L5 and L5 to S1 junctions. Instead of strengthening the abs, you are grinding the spine. Furthermore, this movement creates immense intra-abdominal pressure, which can be dangerous for those with weak pelvic floors, hernias, or diastasis recti. We need to isolate the deep core, the transverse abdominis, without engaging the hip flexors to the point of spinal distortion. The seated march is the clinical gold standard for this. By sitting on the edge of a chair with an erect spine, you neutralize the pelvis. From this stable position, You engage the core to lift one knee at a time. This movement shortens the lever arm, reducing the torque on the spine to 0. It demands that the abdominal muscles contract to stabilize the torso against the movement of the limbs. It forces a neurological connection between the brain and the core muscles that is often lost with age. It is functional, safe, and improves the stability required for walking and climbing stairs. In conclusion, exercising after 60 is not about proving you can still do what you did at 20. It is about applying wisdom to your physiology. By swapping deep squats for chair squats, running for cycling, floor push-ups for incline push-ups, and leg raises for seated marches, you are not doing less. You are doing better. You are choosing longevity and function over ego and injury. Listen to your body's signals, respect your anatomy, and remember that consistency in a safe routine will always outperform intensity in a dangerous one.